Hi everyone, Dr. Steph here from Living Health Integrative Medicine, and we have a real treat today because we have a longtime patient, Patricia Williams. She's actually been a patient of mine for 5 years. She came to us originally for diabetes reversal, and that's what we worked on initially, and I'll let her tell her story as far as the diabetes reversal. And then recently she's been in the office for some physical therapy and chiropractic and some regenerative injections, and we can get into all that fun stuff after we talk about your diabetes success. So why don't we go back 5 years to before you came in, and then what your life has been like since then.
My name is Patricia Williams, as Dr. Steph says. I've been with integrative medicine actually 5 years. I came in originally for diabetes reversal. At that time I was on a high dosage of insulin, and after a year's treatment for that, I'm off of all of the medication that I was on.
And then recently she's been in the office for some physical therapy and chiropractic and some regenerative injections, and we can get into all that fun stuff after we talk about your diabetes success. So why don't we go back 5 years to before you came in, and then what your life has been like since then.
When I first came in to see Dr. Steph, I was hopeless. I really felt hopeless. I felt like this was the end for me. There was no reversal. I was on a high dosage of insulin. I looked at my medications recently. It was 50 units of insulin in the morning, 50 units of insulin in the evening. I was on 2 types of hypertension medicine, and I was on a high dosage of cholesterol medication. My A1C at the time, I mean, I've been up to 12, but at that time it was between 8 and 9. I couldn't get it below 8. And after a month or 2 with Dr. Steph, I kept reducing the amount of insulin that I was taking. I was feeling dizzy because I was taking too much of the
sugars were coming down very well.
My sugars were coming down very well.
Blood pressure was coming down.
My blood pressure was coming down, and so after a year, I was off of all of my insulin, all of the medication that I was on at the time that I came to Dr. Steph, and it was the best investment that I could make in my health. And so this year, I realized, after taking care of my mom and lifting her, and I realized that I was having pain and nerve pain in my arm, with nerve damage in my fingers. And of course my knees were, when I was going up and down the stairs, my knees were getting a little sore and weak,
and before you started your diabetes program 5 years ago, you were 100 pounds heavier.
Oh, I forgot to tell you.
Well, the reason I'm bringing that up is because that's a lot of pressure on your knees for years and years and years.
As a result of the diabetes reversal, the first year, it was about 80 pounds. And then I've, progressively following the program, continued to use some of the supplements, like the 21-day paleo. I love that.
The detox.
The detox. I love that. And so maybe every 3 months, every 2 months, I use that to get back on track, especially if I've gone through the holidays. Nothing's perfect, and I'm not perfect.
Yeah.
But I've maintained my weight loss. I've even lost additional weight since the first year, and that's where I am now. My last A1C was at 6.4 with Dr. Steph, and 6.2 a couple of weeks later with my primary care physician. So
on no insulin.
On no insulin. Zero insulin.
So, but years of being overweight, and then taking care of your mom, and ending up with nerve damage and neck pain and shoulder pain and knee pain.
Yes.
You went to your regular doctor, and what was that like?
Well, I went to my regular doctor, and initially for the pain in my arm, and after an MRI and going to see a surgeon, he suggested that I take prednisone,
Yeah.
prednisone patches, and then also give me a high dosage of some kind of medication, which I told him would only mask the pain. It was a pain medication. Well, he got very upset with me when I said that, and he told me, he says, look, what you have is not reversible. It's a chronic disease that, and all you can do is manage the pain. Well, I've been to Dr. Ste A for the last, I think it's been about 4 weeks now, 4 or 5 weeks now. I have no pain in my arm. I have a minor, pain. I've had minor issues with my nerves, which is nothing like was before, and I feel great.
And that's with, so Patricia came back, and we're an integrated office, so we do functional nutrition,
Yeah.
functional medicine, but we also do physical medicine.
Yeah.
We have our nurse practitioner and our chiropractor, and we do physical therapy and chiropractic. So mainly you had chiropractic and physical therapy to this area.
Yes.
And I'm very, very happy that you came back, because if you had gone with the prednisone patch, your diabetes would have gone back out of control, because the steroid patches, the steroid injections, and the steroid pills actually cause sugars to go up. And so that was one of the reasons why she came back.
Well, and plus the doctor told me during the time 5 years ago, I was also having kidney failure because of all of the medication that I was on. And when the doctor who was looking at my shoulder about a month or 2 ago informed me, he looked at my chart, he says, your kidney's looking great now, okay, we can use the steroid patches. And he looked at my A1C, he said, okay, your A1C, it could increase your A1C a little bit. So all of those little triggers or little signs
yeah.
that this is not quite what I want to do. Then I came back to Dr. Ste A and for her help and her analysis on
the shoulder.
On the
so
shoulder.
So Dr. Andrew saw you. He's been working on
Yes.
this area, and that's been doing much better.
Yes.
And then you also wanted to address the knee pain without having to have surgery later, because that's really
right.
what usually ends up happening is people get lots of steroid injections into their knee, and then they end up having a knee replacement. And so you ended up opting for our regenerative joint injections,
Yes.
and you had it done in both knees,
Yes.
correct? And so what's that been like?
Well, first of all, it was painless. I mean, when I first, thought about it, I said, I'm going to have pain for a week or 2 days after. It was painless to me. I had no pain. I've been out and about. I live in this area and have family in this area, so we have a lot of activities going on as a result. And it's been painless. I mean, I don't even notice sometimes when I used to walking down the stairs has always been my issue.
Yeah.
And when I walk down the stairs, I used to walk down the stairs with grunts and pains and aches. I don't do that anymore, and I didn't realize I didn't do that anymore until a few weeks afterwards. I've continued my exercise. I have a recumbent bike at home, so I do that as often as I can. Dr. Andrew said I should cut it back to about a half an hour, so I do that. I have no pain. I mean, it's only been about 6 weeks, but I'm really pleased with the progress so far. It's another investment in me and my longevity. Mm-hmm. And so that's the way I look at that. So I'm just very pleased with the progress that I've had and the success that I've had with Dr. Ste A and her team over the last 5 years, because they are all wonderful. I feel like a family. Everybody knows me. I really feel great, and I just want to thank Dr. Ste A for her hard work and being available to us. I come from DC, so it takes me, in rush hour, I don't even want to talk about it, but I come against rush hour in the morning, and that's why I come in the morning. It takes me less than 30 minutes to get here, so
it's worth the trip.
It's worth the trip. It is really worth the trip. So thank you, Dr. Ste A, and your team.